Welcome to our next session, relatives. Our state agency partners are about to provide us with an overview of ARPA and FVPSA state funding. But first, if you're still in the need of points for our scavenger hunt code quest, I have a code for you, and the code is nature. Once again, the code is nature. Now, please help me welcome David River, the Domestic Violence Program Manager at the Children, Youth, and Family Department, and Alexandria Taylor, the Deputy Director of the New Mexico Coalition of Sexual Assault Programs. Alexandra and David, you have the floor.
Thank you, Janine, and good morning. I will begin to share my presentation. As Janine said, I'm Alexandria Taylor, she, her pronouns, and I'm the Deputy Director at the New Mexico Coalition of Sexual Assault Programs, which is the statewide coalition that coordinates our 13 sexual assault service programs, our 11 sexual assault nurse examiner programs, and our 11 children's advocacy centers in the state. And I'll pause and pass to my co-presenter today, David River, to introduce himself.
Good morning. I'm David River. I'm the Domestic Violence Program Manager in Children, Youth, and Families Department, which is kind of a strange place for it to be, but we are the state administrator for Family Violence Prevention and Services Act funding. And as we're going to get into in this presentation, the American Rescue Act, or American Rescue Plan Act, happened pretty quickly with a lot of great intentions and a lot of resulting in a lot of bureaucratic confusion. But there's a significant amount of money coming through us for the first time for sexual assault programming and services. And so very happy that the state coalition that Alexandria is part of is going to be our point person, our pass-through funding for this money.
Thanks, David. In getting into talking about funding, first want to start by just giving us a baseline of where we're at in talking about the crime of sexual violence in New Mexico. New Mexico is 7th in the country in rates of sexual violence and has remained in the top 10 in rates of sexual violence for the past decade. What we saw during the past 2 years of the pandemic was an increase, a 20 to 25% increase in folks seeking services through our sexual assault hotlines, isolation, and many of the factors that we have all experienced over the past 2 years. But isolation, increased or decreased access to services has caused us to see an increase in folks reaching out for services at our sexual assault agencies. And then also want to point out that 41% of reported assaults in New Mexico involve children under the age of 18. So when we're talking about sexual assault services, we're talking about sexual assault services over the lifespan. Again, just laying a foundation for our conversation today. The crime of sexual violence in New Mexico, 11,500 victims of rape reported to law enforcement and unreported in 2019. New Mexico needs an updated sexual violence victimization survey. The last one that was conducted in New Mexico was in 2004. And so the best that we can do is use national data that's estimating the incidence of sexual assault in our state. Someone is unmuted. Oh, New Mexico has higher rates of child sexual assaults than much of the country. And 1 in 4 girls and 1 in 6 boys in New Mexico experience sexual violence prior to reaching their 18th birthday. And we know, even though that is an alarming rate, even that is underreported. So just to look at the sexual assault service and prevention kind of ecosystem that we'll be talking about, at the core, you have the New Mexico Coalition of Sexual Assault Programs and the Coalition to Stop Violence Against Native Women, who serve as a technical assistance provider and clearinghouse for many of the service providers across our state. And then in the periphery are all of the other entities and disciplines that we interact with. In sexual violence against Indigenous communities, Native women are 2.5 times more likely to experience rape than other women. There are no sexual assault specific services in any tribal communities in New Mexico. And I want to be clear about that. We are not saying that there are not folks providing sexual assault services in tribal communities. We know that those supports are absolutely happening. What I'm saying is that we have not done a good enough job of making sure that those supports have the resources and are established to provide those services. And we'll talk more about that today. And then we give thanks to the Missing and Murdered Indigenous Women and Relatives Task Force, which has provided really on the ground data and information. And what we are able to see looking at sexual assault specific statewide data and looking at that report is that Farmington and Gallup have the highest rates of MMIWR. And we know that those are the areas that have the longest wait list for services. And so how can we take this data and be really intentional about how we prioritize, resource, and build out services in certain communities in our state? So filling the gaps, we define a community as having adequate sexual assault services when they have all three components: a sexual assault service program, or what you may be familiar with as being known as a rape crisis center, a sexual assault nurse examiner program, and a children's advocacy center. And so what we have identified is that only 6 communities in the state are adequately serving sexual assault survivors. And so we are looking at ways to increase all 3 of those services in communities all across New Mexico. And we know that in certain communities, again, like in Farmington and Gallup, survivors can face anywhere from a 6 to 12-month wait list for counseling services. So we want to be able to address that. And currently, there's no designated sexual assault service provider east of Las Cruces. And no specific funding for survivors who are currently incarcerated. So PREA is the Prison Rape Elimination Act. And so no specific funding that's designated to serve survivors who are currently incarcerated. And 86% of people in women's prisons are survivors of sexual assault. So with state funding, one of the things we've been able to do that we hope to be able to replicate with this increase in ARPA funding is provide culturally responsive services, which include programs being able to have the resources to access Indigenous healing practices. Some of our programs like the New Mexico Asian Family Center offer things like healing services. We've been able to make direct payments to therapists through the Healing for Black Families Fund. The ARC of New Mexico is working directly with survivors with intellectual disabilities and providing services in ways that are responsive to the communities they are serving. Casa Fortaleza has been able to provide services for clients who primarily speak Spanish and are navigating different systems. And again, survivors who are currently not at home in the community, but are incarcerated in a facility. And so again, laying the foundation so that as we get into this conversation about the funding that is arriving in the state, we can be thinking of not just the kind of core ways that we have provided sexual assault services in our state, but also ways that we can truly be culturally responsive in meeting our community's needs. And just an overview of kind of the state of our criminal legal system and the outcomes for survivors. 49% of sexual crime cases were dismissed in district court in 2019. In some judicial districts, up to 91% of sexual crime cases were dismissed. And so we're really interested in, one, addressing what's happening within this system, and two, also realizing that 83% of survivors of a sexual crime do not report it to law enforcement. And so what are the other paths to healing and justice that survivors are seeking within our communities? As we talk about, because this presentation is about money, I wanted to underscore the cost of sexual violence. Rape is the most costly crime in our communities. Each rape costs approximately $122,461 based on the resources that are required to go into investigating and responding to the cases. Also looking at the loss of income and quality of life for those who have been impacted directly by sexual violence. For child victims, that cost is almost double that. It's $241,000. And studies show that there's a strong correlation between child sexual violence and negative health outcomes over the victim's lifespan, such as substance use, leading researchers to recommend that we identify and treat all survivors of child sexual abuse, even those who are now adults. So with that foundation laid, we're going to talk a bit about the 2021 American Rescue Plan grants funds that are now going to be arriving in the state to support survivors of sexual assault. And I'll say that sexual assault programs have not received any specific relief funding over the past 2 years. And so, as you know, in your own communities and across the state, many of our programs, many of our service providers, the Coalition to Stop Violence Against Native Women, us at the New Mexico Coalition of Sexual Assault Programs, have been being innovative and creative and really trying to find resources to support communities during this time, because we did not have specific relief funding coming. So this funding that was passed in 2021, the goal of it is to ensure a continuity of services and to expand mobile and virtual advocacy for survivors of sexual assault in response to the COVID-19 public health emergency through support of a range of in-scope activities. And we'll talk more about that, but including counseling, mobile advocacy, telehealth, teletherapy, peer support, temporary housing, rental assistance, and nominal relocation expenses, supplies, equipment, and software that assist in carrying out virtual services. You know, I had said that telehealth services were many of our like 5 to 7 year strategic plan. And what happened in March 2020 is that got ramped up within a month, right? And we did a lot of things imperfectly, and it created more access for some. But what we know is that it also reduced access for others, right? For those who do not have access to connectivity, to digital connectivity, to high-speed internet, moving to telehealth, moving to teletherapy created barriers for people to access services. And so now that we are here in March of 2022, we want to think even broader about how do we keep the access that was created through telehealth, but also expand access and maintain access that or restore access that had been lost by thinking about things such as mobile advocacy and increasing access in communities. So the purpose of the American Rescue Plan, which was signed into law a little over a year ago on March 11th, 2021, is to help meet the challenges, again, of the COVID public health emergency. And included in this bill is an allocation to assist survivors of sexual assault, which is being administered by the FVPSA office. FVPSA in our state is administered by David, and David River is the FVPSA administrator for our state, which goes through the Children, Youth, and Families Department. So that's the background of how this money, this federal money, is going to flow into New Mexico. It is the intention and our work with Angel and her team at the coalition and our work with CYFD to have this money pass through NMCSAP in collaboration with the Coalition to Stop Violence Against Native Women to provide technical assistance, resources, and training, as well as to develop the RFP that will open this money to include tribal communities to respond to for this emergency fund, to also establish an emergency fund for survivors of sexual assault and to create subawards. David, I will pause there to see if I've missed anything here or if you want to add to kind of how this money is going to flow through the state.
Yeah, and just to be clear, there's tribes who already have are recipients of FVPSA funds, and they got, as part of the cost formula in the federal government, you're receiving this directly. So this is just referring to funds that are coming through to the state as part of the state formula, and then the coalition is ensuring that part of that bucket of money is reserved for tribes who don't necessarily receive direct FVPSA funding. So just to kind of get the full framework, everything's on a formula when it comes to FVPSA, and the state piece is what I administer.
Thank you for that, David. And I do have slides breaking down what is coming through. So as David said, the state money, the money that is coming through the state of New Mexico through the FVPSA administrator, which is the Children, Youth, and Families Department, is on a formula grant, which is based on population, which is based on census data. And so we acknowledge, the challenges and barriers that exist with that. But what that means is that the allocation that is coming directly to the state is about $1.4 million, $1,399,000. That pot of money is expendable through federal fiscal year 25. And so that's the total sum across this multi-year funding. That averages out to about $383,000 that's going to be available annually. So we really celebrate this funding. We really celebrate that we finally have sexual assault specific relief funding. And for those of us who have worked in nonprofit advocacy our entire careers, seeing 1.4 million come down at one time really is exciting. Then when we get into the actual needs of a state like New Mexico and break that across annually, we know that $383,000 is going to be spent annually pretty quickly. And so we want to be intentional. We want to be in collaboration and in coalition building around making those investments. So this is information coming from the Department of Health and Human Services. So the last slide I showed, as I mentioned, are funds that are going directly to the state to then be subawarded out to sexual assault providers. These are the funds that were sent directly to tribes and tribal organizations that were also designated in that ARP funding that was passed on March 11, 2021. And these are the tribes and tribal organizations that were listed in New Mexico. And you can see these total sum amounts there. Again, these are the totals for the multi-year funding that is to be spent through federal fiscal year 2025. So where we are now is that we have the ability soon to begin administering this funding. And as you can see, and David mentioned that there have been some bureaucratic delays Sexual assault funding has not historically gone through the U.S. Department of Health and Human Services, which then funds FVPSA, which then flows through the state, which then goes through our state CYFD. Sexual assault funding has historically been funded through the Department of Justice. So at the time last year where this funding came through the Department of Health and Human Services, the FVPSA office had to build the capacity and the infrastructure to administer this sexual assault funding. And so that's some of the bureaucratic delay that has happened here in getting this funding into the state. Now that we are here, we have the award amounts, and we are working, the two coalitions are working with David and CYFD to establish the contractual obligations and the process. And so we anticipate that later this spring, mid-May, we'll be releasing a short RFP for this funding. And sexual assault service providers are required to, existing sexual assault service providers who meet NMC-SAP's core standards are eligible to apply. And we'll be working with the Coalition to Stop Violence Against Native Women to identify whether you are a existing sexual assault program or a developing sexual assault program, identify pathways for you to also apply for funding through this RFP. We are trying to keep the RFP as low barrier as possible. And our technical assistance is leading up to submission of the RFP is really geared towards those who may not have experience completing an application for funding like that. We recognize specifically in this context for tribal communities, this may be a new process since we've never had funding flow into the state this way for sexual assault services. This is a new process for all of us. And so we want to make sure that the technical assistance we're providing is responsive to the questions and needs of your communities to ensure that these services are available for survivors all over our state. I will again pause there. David, I want to ask about if you can share kind of some of the eligible activities through this funding, and then we can talk about like what that looks like on the ground level.
Great. Actually wanted to share, so I'm your friendly neighborhood bureaucrat in the state, and I found a great definition of it, which I'm going to post on my wall because it's the struggle. A government or an official in a government department, in particular, one perceived as being concerned with procedural correctness at the expense of people's needs. And I think that's, Health and Human Services and the FVPSA grant is kind of a kind federal agency. We want to meet people's needs more than be correct is what I've heard from our federal partners. But there is complexity, and when you push the definitions and boundaries and what's allowable and costs, and I already see the questions coming up in the chat, which is great. There's going to be a million questions about, is this eligible? Is this not eligible? It's really important just to think, okay, how do we make this, what costs can we do that are the easiest argument to make for this funding? And Alexandria shared that slide about maintaining services, creating virtual services, enhancing those things. It's all this funding came about because of COVID-19. So the more that you can make that clear connection that what we're doing with this expenditure of money is meeting the needs of survivors as a result of the COVID-19 pandemic, the safer that you are in making that purchase, and the easier it is for the state to approve a purchase and for the coalition to approve a purchase. So just keep in mind, we can, if you have really tricky requests, can we do this with this money? It may take a long time to get an answer for that. And I always encourage people to think about what's the easiest thing we could do with this money that makes a big difference. So things like, listen, it talks about virtual services. we could purchase new computers, software, burner phones that we can give to survivors. We can help with transportation, anything like that's very easy to say yes to. There's direct assistance to survivors as possible through this funding. You have to be a little tricky because in the federal or in the FVPSA regulations, you can't give cash payments to somebody. And so then you can't also, it gets a little gray. You can't give something or pay for something that a survivor could turn into cash really easily. So things like paying rent for somebody to keep them in their house, buying a security system to put on that house. Those are easy purchases and things you can do. But purchasing a car for a survivor who needs transportation, that would be a little harder because they could turn it into cash. So as far as that, I think it's a great area to look at, is really to help, really directly help people. The things to think about is that you have like an application that survivors can do that's available to everybody, that's equitable. So you're not just picking and choosing people to support, and that you have some kind of a review process. So if you want to do something like a direct assistance program with this money, then think about, okay, what's our procedure that's transparent, that's available, it's fair to anybody who needs the same kind of help as this one survivor that I'm looking at right now. There is a section in the funding that talks about workforce development, and it's turned out to be really quite complicated if the expense is tied to somebody's salary. So if you wanted to do incentive pay for your employees, this has been a very stressful time. It's been really difficult to maintain a workforce during COVID-19, doing this kind of work when you could go to Target and get better pay and get benefits and get your school paid for, and have not the stress of people's lives depending on your work. It's tough to maintain a workforce. But if you're tying this money to somebody's salary, then it gets into all kinds of cost allocation questions about where does the rest of their salary come from, and can this money pay for the whole incentive if 90% of their salary is coming from other sources. But things that are easier are things that support your whole workforce, like giving everybody access to counseling or healthcare, doing some kind of like gym memberships. So there's discrete expenses that wouldn't be tied to somebody's salary that could actually is real help to the people that work for you. So anyway, I could go down this line forever, because what FVPSA did, we had the CARES Act right at the beginning of the pandemic, which did come through FVPSA, and the same structures they're carrying forward. It's, if you look in the funding, they call it the Prevent, Prepare, and Respond framework. And there's a bunch of examples of what is allowable expenses under that framework. And so I am a resource. If you're a tribe that's receiving this directly and you want to brainstorm, I'll put my email in here. Please feel free to reach out. I'll do my best to support you. And I know that the FVPSA office, they've just hired the people about 3 weeks ago that are going to be overseeing the sexual assault funding. So we do have some expertise and some folks in place now that will be on a very steep learning curve, I'm sure, but are going to be helpful to us all. So does that get at it, Alexandria, anything?
Yeah, that was
take a look at the Q&A.
Yeah, that was super informative, David. And I'm looking at some of these great questions coming into the chat, and I'm hoping like we can have conversation about some of these, recognizing that some of this is not definitive. And so I just want to echo what David said as well about the direct funding that went to tribes and tribal organizations. If you were with one of those entities, part of the partnership that Angel and her team at the coalition and our coalition and David with the state want to be able to assist with is also being able to provide, specifically on the coalition level, provide some support and technical assistance. It's our interest as statewide coalitions, as regional coalitions, to ensure that survivors in communities in every part of our state, every part of our region, have access to supportive services. And so if we can be of assistance to you in any capacity, we want to be able to do that. I think some of the questions in the chat as well go to what you were touching on, David. So this is one of the first times actually rape crisis centers have been named in federal statute, that funding is designated specifically for this purpose, right? And so I see a question from April around funds go to policing and providing ethics courses and training. And I don't want to give a definitive answer to that. I'll defer to you, David, about how you're interpreting the regulations. But our first priority, I'll say, I think from a coalition and community standpoint, our first priority is, are there needs on the ground? Are there direct needs on the ground to get services to survivors? And starting there first, since this enabling statute that funded this was really about services. And I'll pause there because I can keep going, but I'll pause there, David, to see if you have, we're in conversation, y'all. We're thinking out loud right now.
Yeah. I mean, education and outreach are specifically mentioned as allowable costs. So, on that kind of answer, that level, absolutely. Right. That should be allowable. Again, the trick would be, and I'll help you with a little language, is tying it to the pandemic. And it really is, the pandemic has put stress on every part of our system, every one of us. So it's not terribly hard to make the connection. And Alexandria's statistic is beautiful. You should use it. The 20% increase during the pandemic of calls to the crisis lines. So, doing outreach and education is one of those specifically named allowable expenses.
I also see another question. Thank you, David. I see another question about whether funds are available for community-based advocates not employed by an agency. And so I'll pause for you there. I certainly have one response to that I can give.
I have a lot of questions there. It sounds very contextual, it'd be hard to give a response from that.
I think that Aurelia, and I apologize if I'm saying your name wrong. What I am reading from that is that, as we know, the grassroots of sexual assault advocacy are individuals supporting folks in their communities, right? Without an organization umbrella, without a social service organization or behavioral health organization or even tribal entity umbrella. There are individuals in community every day supporting other community members. And so we see this all the time because that is the roots of our movement. And because, this is federal funding that is coming through a state agency, and we also fall under the complex of having an IRS 501c3 tax determination, there are regulations and limitations, right? And one of those is often our ability to fund individuals doing the work. One of the ways that we have been able to be creative in doing so is by setting up an emergency fund and being able to make those direct cost payments on behalf of survivors, right? And so if there are needs that survivors have, being able to make the payment directly to the hotel, be able to make the payment directly to the daycare center, or whatever the impact someone may be experiencing due to their sexual assault victimization, being able to use that funding to make those direct payments on their behalf in support of them. But it is one of the limitations that we experience because of all of the bureaucracies and regulations that we operate within.
There's a question about that DV survivors, many DV survivors or sexual assault survivors, is the DV agency eligible for this funding? My response just generally would be, let's let this money go to the sexual assault agencies and providers that are specifically that way, because it's the first time, all the things Alexandria said, it's the first time the money's coming that way. They didn't get a share of the CARES Act. There's other American Rescue Plan Act pots of money that are available to domestic violence. So I think the focus really is on primary sexual assault providers.
Thanks for that, David. And then I did see Angel had posted about one of their Pueblo-based members, Behavioral Health, is interested in beginning a survivors of sexual assault group in their community. They did not receive federal FVPSA funding. Might this be something they could apply for the state FVPSA SA funding to support therapists, attendee stipends for healing support? Angel, again, this is one where we follow your leadership directly, right? This is when we're talking about this RFP and identifying supports in tribal communities that may not be like specifically named sexual assault response or sexual assault support services, but the readiness is there. The planning is there. That's absolutely something that, that's what we're hoping responds. That's who we're hoping responds to this RFP, and that we're able to work together following your leadership at the Coalition to Stop Violence Against Native Women and the technical assistance that a program like that would need to get stood up. Again, because it's federal money, I think there are going to be limitations on potentially attendee stipends. But those are all things that, again, we go back to David. We have these conversations about allowable and eligible responses in the budget.
That strikes it. So if you see that for your program, for your community, that you could actually fund a position or a part-time position with this money that's dedicated to the increased need, that's dedicated to outreach, education, mobile services of some sort. Just keep in mind, if you do that, like there is a time limit on the funding. So as far as our part of it, we're shooting to have it all spent by June 30th of 2025. So if you hire somebody for a temporary position, just be clear that it's temporary or pending finding some other money if it really works.
Yeah, and from a statewide, capacity perspective, so like a program, for instance, like the one Angel mentioned in the chat, that would be starting such a vital service. Over the next 3 years, we would want to be in deep collaboration in trying to develop ongoing resources, right? Because to start services and stop services, we want to strengthen communities, not take services away. And so for us to be in partnership and collaboration and developing resources, knowing that these funds have an end date of 2025. And so as is mentioned in the chat, CSVANW did an incredibly phenomenal job of resourcing with supplies and PPE. And so if there are like really tangible things like that as well that your communities need related to the pandemic in support of survivors, those are also things that we want to look to be funding. We might not be able to make direct payments to folks, but if we can get supplies and resources that folks need into the hands of the coalition or into your communities that can be distributed, things that these funds can be used for. We're working with state government, so any timeline is just an estimate, I think, right now. Sorry, David.
It's so true.
And so I think our hope is that we can have an RFP issued no later than May, in hopes that funds and contracting is ready by July. And I think that that's a major hope. we are committed. I know David is committed, and we are committed at the coalitions to getting this funding to where it was intended to be as soon as we can. And so there are, procurement and processes that have to take place, but it is our goal to get this funding into communities as soon as we can. Great questions, you all. Any more questions?
I was going to ask you, Alexandria. So part of our funding contract with the Sexual Assault Coalition is that they'll be a technical assistance provider, and especially in the very stated purposes of moving to mobile or virtual services, mobile services. Can you talk a little bit about what you might be able to offer folks?
Yeah, thanks for that question, David. And so, our coalition is here to kind of provide some of the nitty-gritty behind the scenes support that it takes to provide kind of all of our services, whether telehealth, mobile, or in person. And so one of the things that we have been doing over the past 2 years is, when you put telehealth services in place, you need the policies and procedures to support that. And so we can assist you in developing the infrastructure and the policies and procedures that need to happen in order to protect your entity, your tribal government, your community agency in implementing those types of services, as well as just thinking through like what's most responsive for your community. And so, I gave the example that our current programs are able to support traditional healing services. And so that might not look like having a counselor on staff, but it may look like being able to pay for traditional healing services, right? Be able to contract or enter into an agreement to pay for those types of services. And really our goal is to be responsive. Our goal is to listen and hear. I think each community often develops a different response. And so to really think about, follow your leadership, follow the vision of communities of what's responsive to their communities, and see how we can make it fit within these guidelines. I think we're really good at that.
Would companies be eligible to be named as a subrecipient of a grant if working to develop tech-based tools? Potentially, yeah, potentially. I mean, that would just be a contract with a provider that is developing a tech tool for your program. So potentially, yeah, that's not unallowable.
Yeah, and I think the other part I didn't touch on as well, but was a question around training. And so, one of the things that we like to do is kind of hear what training needs are coming up. And if there are resources that we can put towards addressing that on a broader scale, being able to develop those trainings or bring in those trainings to provide for kind of like the entire ecosystem that's doing this work. And so that is a possibility as well. So if you have training needs within your communities, we would want to hear about those as well. Yeah. I see Janine, which means
Janine
I think
has showed
our time
up.
is up.
Oh, thank you so much for that very informative presentation. I love that you guys dialogued and dug deeper into what's possible, and also, some of the going into some of the things that need to be discussed more with some of our attendees and different entities across the state that have been addressing these issues. So thank you so much for sharing your overview with us.